News Radio 1000 KTOK. I'm Gwen Faulconer-Lippert. The holidays are upon us, and how are you planning on handling them? Well, I'm very fortunate that Dr. Gail Llewellyn Hobson some time ago introduced me to Dr. Ed Beckham, a licensed psychologist, and he has been most helpful with coming up with all different kinds of mental health topics. Tonight, Dr. Beckham has brought with him a colleague and friend, Reverend Dr. Robin Goggs, who is an ordained minister at the United Methodist Church and a licensed professional counselor. Currently, and I love this title, Robin, if I may call you Robin, it is you are the well-being advisor for a large Oklahoma City business. Dr. Ed Beckham is a licensed psychologist who focuses on adults in individual therapy using cognitive behavioral therapy for depression and anxiety. He also does psychological testing for ADHD and autism spectrum disorder. And tonight, our topic primarily is dealing with holiday grief and depression. Robin, should we start with this wonderful quote that you stimulated me with when you sent it to me?
This idea that all change that we didn't ask for can cause grief in our lives. And that's really encompassing, Gwen, of a lot of things in our lives that can cause grief. I think traditionally we think of the death of a loved one, someone we're close to, but the reality, it can be any major loss. It can be a grief that we're going through related to a relationship, to our own bodies, to a work situation. Anything can cause a sense of loss in our life. And then the irony that we're supposed to be living in the most glorious, happiest time of the year, right?
Yes, supposed to be so happy.
Yes. And so that puts a whole nother level of pressure on us in the midst of already feeling disorientated by some kind of loss in our lives.
Well, somewhere I saw a discussion between you and Dr. Beckham, and it included this sentence, and I found it so interesting. Grief is not a mental health condition. It is a human experience.
Right. I'm so glad that you shared that, because anytime we love, we feel connection, and we lose that connection in our lives, we have the opportunity to feel that loss deeply. And that grief is that experience that happens inside of us, that sense of loss, and how our mind and our emotions and our body even manifest that loss. And so absolutely, this idea that grief is can happen in all different ways, yes.
And it's normal.
And it's normal, and it's not a mental health condition in its very basic form, that we all will experience some kind of loss along this human journey. It's part of the journey. Where it can become a mental health condition is if we become stuck in that grief, and it disorders our lives. And sometimes when we've had a complex loss or a compounded loss of multiple things, or a traumatic loss, that can be a whole nother experience of what is a normal human experience along the way. So maybe that's the key factor, is recognizing with compassion towards ourselves, I'm going through something. My life was going this direction. I call it the orientation of the way our lives are going. And then something happened that created loss along the way, whether that be a death, the loss of a relationship, whatever that takes form. And then I'm disorientated by that.
It's kind of like what you're emotionally invested in.
Absolutely.
And it doesn't go the way you think. And so I'm really curious, Dr. Beckham, how did you and Robin come up with this particular idea for tonight?
Well, we were in a committee meeting, and she came up with this idea as a possible presentation. And I loved it immediately because we were coming up on the holiday season. And you were talking about the issue of, is this normal or is it a diagnosis? It's only a diagnosis under certain conditions.
Right.
If it meets the criteria for major depression, and if it impairs the person's life, or if they're suicidal or something like that, But if it's simply a feeling of sadness and you're kind of tired and you lose interest in things, that's not a diagnosis. But if you have major change in appetite, sleep, energy, concentration, nothing feels pleasurable, have suicidal thoughts, or you can't go to work, then it starts to be a diagnosis.
I'm so glad that you said that way, Ed. That's why I love working with you, because you clarified, sadness and depression to me are totally different things, because sadness is I have a reason why I feel this way. And a lot of times depression, which paralyzes us and goes on, we can't really put our thumb on it. But grief and
really?
loss, I mean, if I'm sad because I've lost my job or I've lost a loved one, that makes sense to have that experience of that feeling. But the idea of it spiraling deeper and deeper. So thank you for sharing that even more. Yeah.
Well, my human experience was I married the love of my life, but it was my second husband, and it meant moving away and choosing to let my daughter stay where she was because it was better for her, to stay in the school she was in, and it's Norman versus Oklahoma City. And the reason I'm telling you this is because I've never been so happy and cried so hard, so happy and so sad at the same time.
Oh, that's such a good point, Gwen, because even changes in our lives that we perceive to be good changes and that are going to, improve the quality of our life, if they involve any kind of loss or shift, can create grief. I mean, you described that beautifully.
Well, I felt it.
I would like to say one more thing about the difference between depression and grief, and that is depression typically has a lot more negative thinking. In grief, the negative thinking is fairly focused upon, I'm going to miss this person, I'm never going to see them again. But once it starts to be, I'm a terrible person because I was a terrible child, I wasn't there enough for them, God's going to punish me, anything like that, my future is hopeless. When we start to get into that extreme negative thinking, that's one tip-off that is proceeding into depression and may need treatment.
And that's a good tip. When you find your self-talk is so negative.
Yeah, generalized negative thinking as opposed to very specific negative thinking about I'm going to miss this person.
Mm-hmm.
Yes. So, and do you all deal with clients during the holidays about these? I mean, does it get more intense during the holidays?
I think so, because the pressure to be happy, to be engaged, to do things the way you always have around this time of year, and the reality that grief absolutely takes so much energy to move through. And so the things we might have done naturally and normally or in the past this time of year might not be what we have the capacity to do this time of year. And so, yeah, I think, the pressure that we see in culture to just be happy. I keep saying happy, but, the pressure of this time of year when we don't feel that way. But also, I think this whole idea of recognizing we can still have a holiday experience, but it might look different this year. And that it's okay to define that for ourselves as to what we can do with the energy we have. And also that loss sometimes changes meaning for us. That things that used to mean something for us might not mean the same thing.
So here's a question for both of you.
Okay.
Let's say family, the matriarch has passed away. This is the first Christmas without mom. Is it wrong to say, let's don't do the tree and the turkey and all that. Let's go to Mexico as a family. Is that wrong? Is that running away from your grief?
Well, it's not a matter of right and wrong. I mean, as counselors, we often have people come and say to us, is this wrong? It's like, well, does it work for you or does it not work for you? Is it hurting anybody else? So there's a lot of issues that just don't boil down to right and wrong. But I would think that both Robin and I would say, if you need to go to Mexico to get through that first Christmas, fine.
Do it.
And maybe you might go to Mexico every Christmas after that. Yeah. Fine.
Creating new rituals. that the things we used to do just don't work for us anymore. And so we need to do something new to continue to live our lives.
Well, it's amazing, isn't it, how the absence of a key person can throw everything out of balance.
Absolutely.
You know,
can.
The siblings knew their place, knew where to sit, knew all that. And then once mom's gone, the table, it's like somebody throws all the silverware up and it comes down.
And it can also involve some quite negative issues like conflict over the will, which makes it even worse. Harder.
Absolutely, it does.
Well, and even this whole idea that grieving is what happens inside of us and mourning is what happens outside of us. And so sometimes we see within families, someone might observe how their sibling or another family member is dealing with the loss of someone and think, oh, well, they're not missing them as much. They don't cry. Or they want to just keep on doing things a certain way. And so, the conflict that could be over something real specific, like a will, or just this whole idea of all of the multitude of feelings and the different personalities that feel them can actually cause conflict in families.
So are grieving and mourning quite a bit different?
By a definition of some work that's been done on it, yes. I mean, that the definition I live with that was put out there by Dr. Alan Woofelt was the idea that grieving is what happens inside of us, and mourning is grieving gone public. It's how we experience that outside of us and how we express that and not feel shame about it. That I don't know about you, Ed, but I hear people say, "Oh, I get really uncomfortable if I cry," or
people apologize
for feeling
crying.
their grief. Yeah,
Yes.
People apologize for mourning. For demonstrating their grief, and we don't really have any cultural. I mean, within different groups we might, but a culture where we really embrace what mourning looks like. People take their bereavement leave. Their workplace wants them back and says, "Come back and be the same person you were before." And the reality is when we've experienced some kind of loss in our life, we're never the same because we've had to learn to integrate that loss into our lives.
What an interesting point. We're never the same.
Never the same.
I need to take a break. I'm talking to Reverend Dr. Robin Goggs and Dr. Ed Beckham, and we're talking about the holidays and dealing with depression and holiday grief. We'll continue this when we come back. I'm Gwen Faulconer-Lippert. You're listening to 1000 KTOK. News Radio 1000 KTOK. I'm Gwen Faulconer-Lippert. Dr. Ed Beckham, licensed psychologist, is here with me, along with Reverend Dr. Robin Goggs, ordained minister from the United Methodist Church and a licensed professional counselor. They earlier had a discussion about grief and depression during this time of year, and we thought, boy, that's very timely. Let's talk about it more. So if you're just joining us, you missed one of my favorite things that Robin had said, and it's that grief is not a mental health condition. It is a human experience. And with that, Dr. Beckham was very good at pointing out when your grief becomes counterproductive. How about that?
Right. And when it triggers a process in the brain where the brain's functioning has now begun to change, and the brain has gone off to not just negative thinking, but major changes in body systems such as appetite, weight, sleep, energy, things like that.
And so you should see a counselor.
Yeah, if you start to have too many of those symptoms of major depression, and you can look that up on the internet, what the symptoms of major depression are. When you start to have more than 4 or 5 of those, it may need to have treatment.
Well, I wanted to add this from Reverend Dr. Robin Goggs' bio. And I found it so interesting that you lived in England serving the British Methodist Church, where in 4 years you did 387 funerals. And that caused you to want to explore how people navigate grief and loss. How long ago was that?
20 years ago.
Yeah. And how has your progress gone?
Well, I think my own personal experience with that season of my life was going through the rituals around loss within the context of the faith community and being present to someone in the midst of a funeral. But then the aftermath of that those rituals are so very important to mark the loss in our lives, but the true grieving might begin, weeks, months, years after that week of a funeral.
Oh, yeah.
And so...
And it catches you by surprise, doesn't it?
Absolutely. And what I found, what drove me to do more research on this and do my doctoral work in it was this idea of wanting to show up and fix someone, and you can't fix grief. And so this idea that really it's about being comfortable with sitting with someone with their emotions, which is what led me to become a therapist, was the idea, getting the education that grief is not something that can be fixed, but it is something that we can go through and be intentional about so that we can heal on the other side. And that there's no time limit on it, that nobody can do it for us. But part of my work was trying to understand it and also try to understand how to be present to other people in the midst of that very human experience.
Ooh, how are you present for them? And Ed, you can comment on that as well. How are you present for someone that is grieving and probably pouring their emotions out to you? How do you help them?
Creating safe space for them to do that. Mm-hmm. Because I think that's a challenge, don't you think, Ed, is finding those spaces in our ordinary lives where other people, I think sometimes when we're grieving, we're afraid of making other people uncomfortable with what we're going through.
I bet your nonverbal language is very comforting to people.
Thank you.
And it's something that's hard to put into a textbook of do this or do that. But I bet it's not just the words you use, but your nonverbal language does it.
Just to create a space where someone can tell stories if they feel comfortable doing that. And that has the potential to be a cathartic experience where they might think, oh, my family's tired of hearing, for the 10th time this story of our summer vacation, but I need to tell this story again. I need to hear the story. I need to relive the memories to get me through this very difficult time of missing someone that I love.
What did you mean by the true grieving may be delayed? The true grieving?
Well, waking up and realizing my life will never be the same, which the rituals that we go through, the traditional rituals of planning a funeral or going to the bank and getting all the paperwork, getting a death certificate. I'm thinking of a death, but I'm also thinking that true grieving is when we realize or maybe feel isolation. And you and I were talking about how even though grief is a universal experience, that it can be a very isolating experience as well for people.
I'm surprised you said you can't fix people that are grieving.
I think that's a very liberating thing to realize in our lives. But it's fixing. Think about how much we want. If someone says to you, well, I'm going through this hard time, we say, well, have you tried this? Have you done this? Pull yourself up by the bootstraps. Yes. You should just stay busy. Find a group to join.
You used a couple of words that I tend to pounce on.
Okay. Yeah.
Just and should.
Just and should. Okay,
Explore
hold
those
that
with
thought. Me. Just and should. We are talking about depression and anxiety and grief during the holidays. And I'm sorry if you're just now joining us, because it was very interesting when Dr. Beckham called out Dr. Reverend Goggs for using the words just and should. You just need to do this, or you should do that. So why did you do that, Dr. Beckham?
Well, as a cognitive therapist, we don't have a whole lot to offer about grieving, but there is one area that we do have something to offer, and that is the way we talk to ourselves about the loss of the person and the grief. And if we talk to ourselves and we tell ourselves what we should be doing or should not be doing or should have done, then we start to bring on guilt. And it's one of those things that can start to transition from healthy grieving to depression. The other thing is if we tell somebody else, well, you just need to, whatever follows that is usually simplistic and I'm going to leave the second word blank, simplistic stuff. So it's best not to use the word just, because if somebody said to you, well, what you need to do with your child is just take him off sugar.
Oh.
What you need to do with your child is just spank him more. It's usually simplistic, and it's usually not true.
Well, that's a great alarm bell when you hear the word just
and
or
should.
should.
Yeah,
Either
or
one.
that internal voice that says, I should be over this now.
Yes.
I shouldn't. And I think that's where the guilt or the shame of, wow, I'm still feeling this, and everybody else is ready for me to be through it because they might be uncomfortable.
Everybody else is ready for
Yeah.
me to be through it. Isn't that the truth? So how do we take care of ourselves when we're grieving?
I think first being aware of what our limits are, recognizing, and as I said earlier, it takes a lot of energy to intentionally work through our grief. And so that might create new boundaries for our lives, that maybe what we normally did was do all the cooking for the holidays, and we just don't have the energy to do that this year. Or we don't have the energy to send out cards. We don't know what to say. And yet, stepping away from those experiences can also cause isolation. So this idea that grief is universal, and finding ways to authentically connect with others who might be walking a similar road that we are, and within our own families. It's interesting. So the depression piece that Ed's been talking about, I think, is really important. And you said in our introduction, the anxiety of grief in the holidays. And so, I've been primarily focusing on the idea of death, but the reality is grief can take all kinds of forms around all kinds of issues of loss in our lives. And Ed and I were reflecting on how the loss of a relationship, which may have been there for a long time, and particularly in family systems where there is conflict, brokenness, that all year long we kind of stay away from our family, but these cultural pressures of we are supposed to be connected to our family during the holidays. And what if we're not in a place where we can be connected to people because there's been cut off where they are, they're hurtful relationships? How do we reframe what holidays mean to us to be the experience that we need? It's all subjective, no right or wrong. I like that you said that, Ed. There's no right or wrong way, right or wrong. So, yeah.
So you just take care of yourself?
Yeah, I think taking care of, first recognizing that we can take care of ourselves by doing things differently. Maybe, like you said, we take a trip, or we actually make a list of the things that we have done in the past during the holidays, and we inventory and decide, what am I willing to do? What do I have to do? What do I not want to do, at least this year? And that we can be reassessing throughout the years that we're moving through this reorientation of our life to determine how the holidays might look different for us from this time out.
Are there people that have serious grief going on and don't know it? Is that possible?
I'm not sure I run into that very often. How about you, Robin?
I think people are pretty aware when they're hurting.
But they don't admit it. I know some very stoic people that won't admit it.
Okay. I think in the role that I play in people's lives, they know something's going on inside of them that brings them into a therapeutic setting of, it's manifesting in a physical way in my body, or I'm no longer interested in the things I used to be interested in. I'm not connecting with the people I used to. I think divorce is a real interesting topic to also talk about around the holidays and grieving.
Oh, all that sharing and
because it's one thing. It's interesting because it's one thing if people know I lost my spouse during the year and I'm going to be going into the holidays without my spouse because they died. It's another thing to say I lost a relationship, but that person's still in the world because they're still, even though we know there's a lot of statistics around divorce that have almost make it a common experience, it's still an experience that has a lot of stigma to it and a lot of shame to it.
So how do you know if your children are grieving a divorce? Just by their acting out?
What age child are you talking about?
Oh, let's say 12 years old.
I'm sorry, I'm not a therapist for children.
I'm not a therapist for children either, but sometimes I've filled that gap in different places in my life. And I have children. I think the idea that the same thing we would pay attention in ourselves, that if our rituals and our patterns, or we've lost that, or we see that a child has lost an enthusiasm for something they used to do, or maybe they're acting out
acting out
in
low
a negative
grades.
way, with behaviors. And so many times we get on to children for negative behaviors instead of being curious about those negative behaviors. Like, that's not a part of you that usually shows up and throws your your toys across the room. Let's talk about why you're throwing those toys right now.
So anger, loss of interest, things like that. In depression, it is possible to be depressed without feeling depressed. And people go, how is that possible?
How is that possible?
How is that possible, Ed? Well, I'll tell you how that's possible, Gwen.
Please do.
In the diagnostic manual, you need one of two things, either persistent depressed mood or pervasive loss of interest. And some people don't have the sadness or that feeling of depression, but they have a pervasive lack of interest in doing anything. Their pleasure circuits in their brain are impaired. So they have the sleep, the appetite, the energy problems. But instead of the depressed feeling, they have the lack of interest. And so they are often very unaware that they're depressed.
And so how do they usually find out? Their kids say, Mom, why don't you go to dinner with us anymore?
Yeah, something like that. Or maybe they never find out.
Never find out.
There might be people in our audience right now who are depressed and are going, oh, well, maybe that's me.
Well, boy, that's a good place for us to think.
Well, there's one thing I'd like to re-emphasize or emphasize more strongly, is that when we're going through a loss, our job position or a marriage or other relationship, it's very disruptive of all these things that have become static. And it's an opportunity for growth. There is more to us than we think there is. We feel like our life is over. In some ways, it may be just beginning. Now, understand, I'm not eager to seek out this opportunity for growth. So
I don't pray for clarity either anymore.
Yeah, so God, if you're listening, you can give my share to somebody else. But it is an opportunity for growth, and it's a painful opportunity. But we get in these ruts in life, and we think this is all there is to life, and this is all there is to me. But there is more to us. And look at Gail Hobson. I mean, she's traveled the world, hitting all the different continents, right? Wow.
Yes, she's moved on. That's right. And Robin, one of the quotes that you made reference to before was by Dr. David Kessler. And
yes, that all change in our lives that we didn't ask for can cause grief. And so just imagine the laundry list of when we frame it that way, how it opens up whatever those losses could be. You know, a major health change, dealing with a chronic illness that we didn't know we had last holidays, and how that shapes things differently.
Yes.
Yeah, we're being in the workplace, the place we used to work with our work friends going into the holidays this year. That anything, I was saying earlier that one of the things might be someone who's in recovery this holiday, that last year, if they were using substances to celebrate the holidays and not having that this year, that it creates opportunities for growth into new rituals that help us survive this time of year, especially if it's the first year we've had to deal with this change in our lives. And so this attentiveness to the intentional path through feeling our feelings and moving towards healing includes attending to our basic needs and being still and learning to relax. And if we can, maybe joy and gratitude look different this year in a different way.
You have used my favorite word, and that is gratitude.
Yes, that it's a great antidote, isn't it, to sadness at times.
I'm wondering if people in our radio audience are thinking, how can I feel grateful in this situation? You don't know what I'm going through, how painful this is. What would you say to them?
What can you find in your life right now that reminds you that you're alive?
I find a daily walk and to get out, breathe some fresh air, and be grateful that I can do that helps me.
And how can I make a truth in my life that I'm not alone, even when I feel alone? And so I think that goes back into what you were saying, Ed, about the isolation of depression and grief is huge and overwhelming, and it requires an intentional step to keep moving through that. Now, that would be maybe different than the clinical work that we were referring, where a grief becomes problematic because it becomes depression that really erodes the life that we have known. But the idea of moving through the sadness of a human experience of grief requires an intention to keep that movement.
Is it comforting to think about that everybody's going to have to go through this? Is that comforting to people?
You know, it might be for some to know that I am not the only person going through this. And it might be comforting for 10 minutes or an hour.
That is so
true. Or maybe a day, but I'm not sure. I mean, everybody's so different. You know, some things that work for me, coping in a situation, will work at one time and not at another time. And so we just have to use all the different coping tools that we can find. But that could be one coping tool.
When you talk, I think in terms of pictures. I hear things like pictures. And when you said that, I thought of that expression about the turtle in the middle of the road. You can stay there and be stuck and get squished, or you can put your head out and crawl away as best you can.
Yeah. So getting stuck, you know, one of the things that people want to do sometimes under immense stress is to just go to their bedroom and shut the blinds and shut out the world. And
is that
which
wrong?
Is not right or wrong.
Oh, that's right. Is that unhealthy?
It's probably not healthy. It probably is not going to make them feel better. So what they need to do is find some way to get out of the house and the apartment. But it's hard. But what your body wants to do in the immediate is to just hunker down. And somehow you need to find someone to support you to get out and make those contacts with people.
Well, and the idea that when we're feeling such intense feelings in our life, we tend to think, I'm the only one that feels this.
Yes.
And so when we can universalize, not minimize our experience, but we can universalize it. And I actually believe that's why support groups are such an important part of our culture, and that we have them all throughout the city for all different kinds of needs. And so wherever we are, because the people that we do life with, we might feel like, oh, I don't want to burden them with how I really feel on the inside. But if we can go sit in a group with other people who have an experience, and it's not the same experience as ours, but there might be some crossroads of similarities, then we can feel connection. And that's such an important part of healing, is not feeling isolated in our experiences.
And of course, Robin and I both do psychotherapy. And one thing I would say is, for some people, they might benefit from it up front when they're going through the most difficult, painful part. For others, they might benefit from it after that's over and they're ready to step out into the world and change and do things differently. So there's different stages of going through grief, and people might benefit up front or later on, because up front they might need the support of someone to talk to every week. But later on, they might be ready to actually do some changes.
So tune up, like a mental health tune-up.
Mental health tune-up, yeah.
Yes.
The other thing I think when we're grieving is this idea of recognizing our energy levels and allowing those, being so self-aware and self-compassionate that we can set boundaries this time of year around, and not feel guilty for saying no. No, I don't want to make a casserole this year. No, I don't really want to go to that party this year. I'd rather have a quiet time and have a few people over and order in some food, that we can change things up to meet us where we are in our emotions.
Yeah, I'm glad you mentioned that because, we tell people it's okay to set boundaries, and then they encounter people say, well, what's wrong with you? And say,
Oh, people don't like it when we set boundaries.
but they can say, well, Reverend Dr. Robin Goggs said it was okay.
Oh, gosh.
I've been given permission to set boundaries.
That's a whole nother radio show is on boundaries, believe me.
Well, and to just mess it all up, all change we didn't ask for can cause grief. So a person's change, we're not going to come to my house for Christmas this year, might stimulate some grief in others too, you think?
Right. So is not the ability to communicate in healthy ways about our grief really important? Whether that's bringing people together who have had the same loss and being compassionate with each other, or educating others as to what we need as we're discovering it ourselves when we're grieving.
Yes. Dr. Beckham, do you want to leave a way that people can reach out to you?
My office phone is 405-840-9999.
Okay. And Robin Goggs, I don't know if you even have time.
People can reach out to me at 405-306-2238.
Thank you both. Thank you both for your time. And I think this is really great advice.
Thank you for having us.